Hello everyone, my name is Liliana Alanis and I will be presenting my research project. The title of this project is The Effects of Culturally Accepted Foods and Alternatives on Hemoglobin A1C and Weight in Hispanics with Diabetes. The reason behind this project were several family members dealing with diabetes. As Hispanics, food is something that is valued, so the idea for this project came from seeing the difficulty of letting go of those cultural foods. Diabetes is a chronic condition that is affecting many people. There are 37.3 million people in the world with diabetes, and about 11.8% are Hispanics. Hispanics are also the second highest ethnicity with prevalence of obesity, with a 47.8%. The Hispanic population is the largest minority group and the ones with the higher risk of developing diabetes, the risk of developing end-stage renal disease, retinopathy, and requiring amputations is also higher in the Hispanic population. There are several factors that can worsen the management of diabetes. These are things like the sedentary lifestyle and an unhealthy diet. The research was based on the PCOT question in Hispanics with diabetes. Does educational intervention on culturally preferred foods improve A1C levels and weight? The purpose of this scholarly project was to achieve better A1C control by modifying diet to include culturally accepted foods and alternatives while decreasing carbohydrate intake. Secondary aims included improving daily and weekly glucose readings, improving adherence to diet recommendations, decreasing risk for diabetes-related complications, and improving patient quality of life. The hope was to have better patient adherence to diet by including culturally preferred food and alternative options that keep the same flavors. This was a quantitative exploratory research design with a retrospective chart review for baseline A1C levels and weight. This data would be compared to the post-interventional data collected. During the process, all potential patient identifiers were removed and only the minimum data necessary was collected. All the files were kept in locked cabinets and in a locked office. So this project took place at Rodriguez Medical Clinic, which is located in the southern part of Texas. This clinic cares for about 7,000 patients, in which the majority are Hispanics, and many of them do have the diagnosis of diabetes. So while the research for this project began a while back, data collection took place between May 2022 and August 2022. The project consisted of 40 participants, female and male, between ages of 50 to 65, with the diagnosis of diabetes, who met the inclusion criteria were included in the study. So the intervention consisted of educating participants on culturally accepted foods and the alternative options available. List of culturally accepted foods and the options or the alternatives was given to the participants as well, so they could have handy or look at it at home frequently. They were also encouraged to keep food diaries and blood sugar logs to monitor if changes were um, causing an effect on the daily blood sugar readings. So the materials used were very minimal, as the main material used was paper just to print the recruitment flyers, educational pamphlets, and research materials. So the results. All the data collected was analyzed using the SPSS statistical software. This was done with the help of Dr. Paul, who is a statistician at Maryville University. So to enhance the validity and reliability, all participants were provided the same education and nursing intervention. The data was based on the 3-month collection period. So normality tests were done on both A1C and weight data. The hemoglobin A1C did not follow a normal distribution, which fails the assumption of normality. The Wilcoxon test was used to evaluate hemoglobin A1C data for significance. Weight data did not violate assumption of normality, so a paired t-test was able to be done to evaluate significance. The sample size consisted of those 40 participants to produce an effect of 0.5, significance of 0.5, and a power of 0.8. The Wilcoxon test was used to evaluate A1C levels, did not follow normal distribution on the Kolmogorov-Smirnov test. So the Wilcoxon test determined there was not a significant statistical change in A1C levels between the pre and the post intervention levels. The power was 0.28, V was negative 0.418, P was 0.6. To evaluate weight, a paired t-test was used as it followed distribution normalities based on the Kolmogorov-Smirnov test. The paired t-test also indicated no significant change in weight. Power was 0.20, T was negative 0.85, and P was 0.4. So a post-hoc analysis was also done to evaluate power for both the hemoglobin A1C at 0.28 and the weight at 0.20, which indicated low power. So statistical significance, no. So even though not a statistically significant change, 45% did show improvement in hemoglobin A1C, and there was also a 57.5% of participants who lost weight in the 3-month period of the study. No change was noted in 5% of the participants in both A1C and in weight. This indicated additional research recommendations practiced to revamp the intervention. This became evident based on the results. So was the research question true or the peacock question true? I believe yes and no. And this is due to the fact that there were changes in A1C and in weight in some of the participants, but not in others. So it did make a difference in some, might have not made a difference in the others because they didn't follow the diet as recommended, they didn't do the changes, or they didn't limit the intake. Several factors could have played a role. This could have also been due to short time period, because sometimes it does take up to 4 months to see changes in the hemoglobin A1C levels. And sometimes it takes time for changes in diet to be kept consistent by the patient. So this further pushes those changes in the A1C level. The small sample size could have also affected the results. Maybe having a larger sample size would have had more accurate findings. So some significant observations were noted through the findings. Um, by continuing education about diet, it could help improve adherence and decrease hemoglobin A1C as well as weight. Many have no knowledge or had no knowledge on possible alternatives while maintaining those flavors that they're so used to or accustomed to, or that are part of their cultural beliefs or cultural, just what they were, eating since they were little. Um, so by continuing that education and allowing or educating patients on those alternatives and maintaining those flavors, this could lead to better adherence, better diet adherence, for better diabetic management. So with this project, it did help understand the values and the beliefs on those cultural foods. And sometimes simple changes like changing white rice to brown rice can make a difference in, you know, your daily sugars or your hemoglobin A1C. So observations noted that could have affected the results, like I stated before, the small sample size, because because a quantitative study usually requires a larger sample size, and these type of studies also do not provide, in this case, like a detailed description of the diet being consumed. While we encourage that, they don't always follow through with it. Um, Another thing noted was that a change or a stage of change assessment could have been done um, to determine the participants' readiness for change. Uh, this would have helped determine if that patient or that participant was willing to make those changes, and if not, another participant or another patient could have, joined the study instead of someone that was not ready to make those changes. So one thing that can be done differently also was to branch out the project to include other ethnicities, not just Hispanics, as well as the other clinics around the community. This would help to achieve the larger sample size required by a quantitative study. And this would allow for more data to be collected, as well as the ability to generalize the result when you include, both female and males, include all the ethnicities or races, and the results can be generalized to the majority of the population in the community. Future research would include following up with the patients or the participants more frequently, keeping a record of daily blood glucose would be beneficial, as it would show whether or not the intervention was working due to the variability based on the diet. This would also allow for more education to be provided to the participants and allow them to make adjustments as needed. The diabetic diet intervention concentrated on culturally accepted foods and the alternatives that are available. and which this can be a bit overwhelming, so much information on diet and the foods accustomed to and finding alternatives. It can be overwhelming for a patient. So providing several discussions or several sessions could enhance what has already been provided or previously provided and can refresh the information from the very beginning, or just refresh the information and help them make those changes, those better choices, while still keeping those same culture flavors that they're um, used to. So, and this would also allow for the providers and the nurses to implement a more detailed education on diets that include those culturally accepted foods and alternatives available. So, while doing the research and completing this project, there was relations or relationships to previous studies and findings that were noted. Previous research has shown that interventions that are culturally tailored are effective at lowering weight, risk factors, and improving diet self-efficacy. So comparing this project to other studies, while the results were not consistent in some, they were similar in others. In one of the studies, statistical significance was found with all the variables used except for one, and the variables used were weight, waist circumference, BMI, and diet self-efficacy. All these variables relate to the project because weight management and diet will affect the weight, the waist circumference, and the BMI, um, as well as adherence, to the diet. Um, in the other study, the variables used was weight. The interventions related to Hispanics foods and recipes, and the Hispanics' beliefs in diabetes. And in that study, the intervention appeared to be only modestly effective. So this demonstrates that diet plays a big role in diabetes, as well as Hispanics' belief on diabetes also plays a big role in its management, because as a culture, um, different things are kind of implemented in you as you grow up. So in the Hispanic culture, there are several things that will affect how you see diabetes or how you see certain conditions, diseases, and you know, diet, food plays a big role in those conditions, those diseases. So those are two things that do um, make a difference in the way a Hispanic person will manage their diseases. So, like I stated before, millions of people are affected by diabetes of all different races, different ethnicities, and giving patients the required education on diet management would improve hemoglobin A1C levels as well as weight. And even though the project outcomes did not line up with the expected results, some participants did show a decrease in the hemoglobin A1C and weight. So future interventions should focus on including culturally accepted foods and alternatives into diet management education. Steps would include, longer time frames and frequent follow-ups to determine impact of interventions, and this would allow for adjustments to be made while the process is still in place. The study did not provide significant changes due to could have been due to limited time frame and possibly the small sample size. So this shows the need for further studies on this topic. The recommendations for studies on this topic um, would be to consider the time frame and the sample size to help provide more accurate results and results on the effects of those culturally accepted foods and alternatives or alternatives to replace those cultural foods, um, and evaluate the effect of that on the hemoglobin A1C and weight, beliefs on diabetes, and the values of those foods and flavors should be taken into consideration to help find alternatives available as well. This concludes the presentation for the GMP project. Thank you.